Hmm. Welcome, welcome. I want to give people a few minutes to come in, but welcome to our Connecting Families session this evening. We'll get started in just a minute. All right. Well, welcome everybody. We are so excited that you're here this evening. For those of you who don't know me, my name is Elizabeth Bostick, and I am going to be your hostess this evening for this month's Federation for Children with Special Needs Connecting Families. And tonight we are going to talk about collaborative advocacy. How do you actually work collaboratively and strategically in order to successfully advocate for your child if you happen to have a child who has a low incidence disability? It's a topic near and dear to my heart, as my son, many of you may know, King James was someone with low incidence disability in terms of the fact that he had connectors, which is something that is sadly starting to rise back in the United States again. But before we get started, I wanted to remind you that if you are in need of interpretation services so that you can understand, there is a link in the chat that will take you to Wordly, and there you will be able to access your language of choice. Um, we are really excited to have Thomas Miller with us this evening. Um, Tom is a special education professional with nearly 50 years of experience and a longtime instructor at the university's Severe Special Needs and Multiple Disabilities Graduate Program at Boston College, and has been named the interim director of the campus school at Boston College. Since 2018, he has supervised BC graduate students' practicums in addition to serving as an independent special education consultant, providing trainings, program evaluations, and special service advocacy for students with visual impairments, multiple disabilities, and or deaf blindness. So we welcome you, Tom. So thank you so much for joining us this evening. We're going to remind people that please insert your questions into the chat, and we will ask you to do that as he is presenting. Once he's finished presenting, if he hasn't addressed your question, we will be going in the chat and circling back to answer all of your questions. And if we don't have time to do that within the hour that we have tonight, then we will absolutely then take the time to go back, answer the questions, and post the answers on our website along with the recording of tonight's session and the PowerPoint. So you'll have all of the information available once we're actually finished one way or another. All right, so then without further ado, Tom Miller, please tell us about collaborative advocacy.
Hi, everyone. So it's an honor to be presenting for the Federation. What I'm going to be talking about tonight, and the title is Collaborative Advocacy, is trying to look at ways that we can advocate for our children and create a connection with the school district. You know, many times we go into advocacy situations and we're ready to fight. And I'm going to try to present a couple of techniques that have worked in the past for me, and ideas about ways of going into the IEP meeting, going into connections or meetings with your special education directors or whoever in a way that's going to promote positive outcomes. Okay, this isn't changing. Sorry. So, you know, I'm going to stress a few things tonight. Families as core members of the IEP team, the concept of building a team vision, and how can we do that collaboratively? And one of the things that I want to talk a little bit about tonight is the IEP. I mean, because that's the guiding document for your program or for your students' program. And it's all based around a collaborative philosophy. The new IEP in particular, I think, has done a nice job of trying to reinforce the role of the family in the collaborative process. And then obviously collaboration is a key concept. If we look at definitions, so a definition of collaboration is a joint effort of multiple individuals or working groups to accomplish a task or project. Okay. And when we look about or think about the IEP team, that's who we are. We're multiple individuals with different areas of expertise. You, as family members, have expertise about your child. The PTs, OTs, speech, the teachers have expertise in their fields. And none of the programming that we do for individual children is going to work unless all those pieces come together. All right. So here at the campus school, where we serve children with complex needs, we call them students with extensive support needs, meaning that, our goal is to find communication answers, mobility answers, how to more effectively use their vision, how to deal with their medical situations in a way that's going to enable them to show us what's inside, to give us an understanding of the fact that once we find a communication tool, they are able to communicate with us and to really let us know that there's a lot inside that has been hidden for years. The other key word is advocacy. Now, this definition, hold on, is there a way I can change the view? No. All right, sorry, it's covering some of my slides. So this definition, talks about pleading for, supporting, or recommending, but I kind of like the last phrase, active espousal. All right, advocacy is a continuous process, right? Your child changes over time, and you need to be committed to that. Sometimes you need to have courage to do that, but it's a process that teaches us how to interact, understand, and work for a common goal. And it's really about building relationships with people. And throughout this presentation, I'm going to stress a lot on those relationships. So this little picture here, I came across this years ago, as you can see from the date, 1976. But it's a concept that there are what we'll call words that we use and that are not productive. Okay, dirty bricks. They build walls of separateness between us and ourselves and others, engaging innumerable hours in negative preoccupation. All right, and patching sore wounds. And what this means is that if I was to ask you, can you give me a couple of things that you might say negative about a special education director? I'm sure you probably could. Could you say a few things about a PT you didn't like, or OT you didn't like, or a teacher you didn't like? Or maybe, another parent that you didn't get along with. And we can all find these dirty bricks that we can throw at each other, right? And what happens in those terms, using these terms, they are non-productive in that we're not building relationships, we're sort of blocking the creation of positive relationships. And the whole goal of what we want to do when we work as an IEP team and we work together for the benefit of our students is that we want to be effective. And this little picture here definitely shows a lot of ineffectiveness, okay? One person doing all the work. And I'm sure as parents, sometimes you felt that way, that, you were the only one advocating for your student. So when we think about these dirty bricks and things, and we're going into a meeting, we want to be aware of opinions and perceptions that may cloud our ability to function within the meeting. And this goes not just for parents, it goes for me as an educator. When as a special education director, as the interim director here at the campus school, I go into a lot of meetings and I have to be very careful and mindful that I don't bring in baggage that's going to cloud my ability to really function well as an advocate for the students here at the campus school. So each child, each family, each team is unique, all right? And you know that, okay? And the team uniqueness is the piece that sometimes is the biggest challenge, all right? Because you develop your child is, birth to 3, you develop your team, that EI team, and then you have this transition to preschool. And that's not always an easy transition. It's hard to leave the home-based services of early intervention and move to a new setting where now you have to trust other people with your child. And so when we begin to make these transitions, not just to preschool, but then to first grade, to middle school, to high school, and finally into adult programming, every one of those transitions can be tough because each time you have to connect and build with a new team. We need to be careful not to prejudice team function by depending on opinions of others about individual members of the team. So this may or may not have happened to you, but at times, you'll hear from another parent, oh, this OT is terrible. This teacher of the visually impaired really doesn't know what they're doing. And you end up getting a clouded picture of the team member, which inhibits your ability to really form a productive relationship. And so we need to be watching out for that when we're thinking about or going into meetings. The IEP is very emotional, and I'm going to say for all team members. And we have to be careful about and acknowledge and diffuse some of our emotions. As a parent, you may go into a meeting feeling threatened by the fact that there's 10, 12 other people sitting around the table, talking about your child. And that can be a threatening situation. The team members, not every team member is really secure in their knowledge all the time. And they may feel nervous in the meeting. And what we need to do is to be thinking about and acknowledging the fact that we're all going to bring different perceptions in, different emotions into the meeting. But the goal, and if we keep the end goal in mind about the student, we should be able to resolve some of those emotions. And then finally, the biggest thing is you need to form your own perceptions and working relationships with team members. And again, I'm not saying that all this is easy, but it is a key part of effective teaming. So here's a couple of rules of behavior to think about when you go into a meeting. All behavior is designed by the person engaged in it to serve his or her own values. So if we were in the room, I'd have you do some activities. But if you were to think about something in your life you tried to change, say you wanted to lose weight, for example, all right? I'm told often that I need to lose weight, okay? And unless I make the conscious decision that that's a value that I need to honor, I'm not going to lose that weight, right? And when we think about all the people that are in that IEP meeting that we're having, they all have different values. They all have different reasons for being there. But there is one common reason in most instances. I'm not going to say it's 100%, but we're all there to talk about that student, all right? And the more we can bring the conversation back to that student, all right, the more we tap into the common values of members of the team. The other golden rule is you should never expect anyone to engage in a behavior that serves your values unless you give them adequate reason to do so. So what does that mean? Well, it means that I may not understand, all right, why you want me to change my behavior, all right? I don't have the necessary knowledge to really make the change that you think I should make for you, all right? So for people to change their behavior, you have to establish a can condition, okay? Which means that people have to feel both the competence, meaning they have the skill and the knowledge to make the change, and the confidence to make that change, all right? Because it's a self-image thing. And we all feel that, all right? So again, go back to something you've tried to change in your life or a skill you wanted to learn. Say you wanted to learn how to play the guitar, all right? You need the skill and knowledge to play it, but you also need the confidence to go out there and try it, okay? And unless we get that can condition in place, people's values and behaviors will not change. Good example. So, and I don't think I have the picture. No. A good example is the weather, okay? So I'm going out on a job interview, all right? And I have to walk to this interview. And I go outside and I start walking to the interview and it starts to pour rain. And I don't have an umbrella. I'm not prepared. All right. I don't have the confidence or knowledge that I needed to successfully get to this job interview. Whereas if I had listened to the weather, knew it was going to rain, I would grab an umbrella and I would be covered and get to the job interview working the way I should. Hopefully that's a good, clear example, but we'll give some more examples in a minute. You want to use your behavior to create perceptions that create adequate reason to stimulate new behavior. Meaning that we want to help people understand better what we want them to do, in this case for your child. All right. And the way we're going to do that is by using some techniques that I'm going to suggest in a minute. But if you look at this slide here, you see two people trying to get a message across. Okay. And this illustrates the point of understanding. So one person is sending a message, and their message is coming out, the person on the person with the sending the message is encoding the message, all right? And he has to think about his ideas, his experiences. He has to do that through his emotions, his knowledge, his vocabulary, and he's going to try and send that message to the person across the way. In the meantime, you have external factors, like it may be noisy in the room. The other person may have a hearing loss. There may be things going on in the environment that inhibit the message going across. But even more so, the message has difficulty getting to the receiver, or the receiver understanding the message, because they too have a different background, a different culture, a different understanding, a different experience of life. And so it's very difficult to communicate the message, all right? And this happens so much in the work that we do because we all come in with our different perceptions and perspectives. And the challenge is how do we get people to understand our perspective, you as parents, and in a way that it's going to tap into their values or create new values for them. So the way to do that is to create shared understanding. All right. So the lack of understanding of the impacts of extensive support needs or complex medical conditions, in this case, creates a lack of access to learning, and it's a major impediment to comprehensive service provision. It's a long way of saying that I, as a provider, all right, I get to know your student maybe through my area of expertise, but I, as a provider, need to know your student really well. And I need to understand, what the issues are with your student. And in many cases, we forget that that individuals in the field of special education may not have training in every area, all right? So even a SPED director, a special education director, when they take courses, they get an overview of different disability groups, okay? And they don't get a comprehensive understanding of every group. So, for example, my background is vision and deaf blindness and multiple conditions, right? And, so I have that perspective. But if I'm going to work with another type of student, like maybe a high functioning academic student, I'm going to maybe at a loss. All right. I may not understand some of the conditions, or, a student with Asperger's, or any other group that is outside my area of expertise. And when we think of special education directors, they have to learn and understand multiple areas. And our goal when we go into a meeting with them is to really help them understand more fully the conditions that our students are presenting. I don't know, Elizabeth, am I supposed to stop and ask if there's any questions or?
But no, the people will be putting their questions in the chat as we go along. So, I mean, it's always helpful to just pause and see if something's unclear. So I certainly would.
Yeah, so I'd like to ask at this point
Okay.
if it's hitting the mark for families.
Yeah, we haven't seen any comments in the chat yet.
Okay,
So
all right.
I think we're doing well.
So what I'd like to give you is a visual image here. And, when I say that, special education directors or people in general, society in general, may not understand our students, it's this picture tries to illustrate that. So if you look at the smallest figure on the screen, which is the one down in the middle, um, that really represents our individual student. All right. So I'll use the example of a student with visual impairment, so deaf blindness, I'll take. And that student with deaf blindness is a low incidence population. Okay. It's much lower incidence than many of the others we will be talking about, but it's a low incidence population. And all those people around really don't understand the deaf blindness. All right. They may have heard the word deaf blind. They may have been exposed to Helen Keller, through the movie, The Miracle Worker, but they really don't understand deaf blindness. So when we go into a IEP meeting, my goal as a deafblind educator is to really help the team understand the different learning styles, different issues that a deafblind person faces, accessing the curriculum, accessing the environment, accessing their peers, and participating in the life of the school. Okay, because most people haven't studied deafblindness. And that goes for a lot of the low incidence conditions and even autism, which is no longer low incidence, but it goes for all those situations because even though a child may be labeled as autistic, that child is unique, all right? And that the person can't be just that label of autism, just like they can't be just a label of deaf blindness. But we have to help people understand that their learning style and their approach to the world is totally different. I'm going to use deaf blindness again as an example. So many of you have heard the story about the men with the elephant, right? So the 3 or 4 individuals who are blind, we'll just use blindness, who are blind, go up to an elephant, and one touches the trunk, and one touches the ear, one touches the body, one touches the leg. All right. And one says, "Oh, I understand an elephant. It's like a hose." And the other one touches the ear. "I understand the elephant. It's like a fan." One touches the body. "Oh, I understand the elephant. It's like a rough wall of bricks." And one touches the leg and says, "Oh, it's like a tree trunk." And what they don't have is the whole picture of the elephant. And for a deaf blind individual, or even an individual with blindness, they learn about the world differently than we do. So we learn about the world from the whole to the part. They learn about the world from part to whole. And what that does is that their worldview is different. So when I work with when we go into a meeting, I need to be able to articulate that the way that they access the world is different. And that applies to all types of disabilities or conditions. All right, autism, students with autism access the world and learning differently than individuals without autism. So how do you do this? How do you create this shared understanding? So if in the case of students with vision loss, we have simulators. There's an app called the Tango app, which you can simulate different types of visual conditions. And because people haven't experienced that, again, the person's understanding of blindness often comes out of what they see on TV. Most people have not met blind individuals or had intense interactions with blind individuals. They don't understand the impacts on learning for those individuals. For autism, I just Googled positive images of autism videos, and there are many of them on the internet that you can use to display a child with autism and give a picture. Now, it's not your child, but a picture of their capabilities. All right. The stress here is on positive images of different students with different types of syndromes. Or in some instances, using the video clip of your student or your child themselves. Because what you want to do is not to show stereotypes, which is what most people understand about disability. is we want to reinforce the qualities and strengths of individuals that can be unlocked through effective interventions. All right, and I'm going to stress that again. We want to reinforce the qualities and strengths of individuals because every one of our students, every one of your children have unique qualities and strengths. And sometimes that can be hidden behind the stereotype label. And, the whole goal of an effective IEP meeting is for people to really understand the uniqueness of your child, the uniqueness of their learning style, the uniqueness of their needs in a productive way, so that the whole team can then become united, and the team, including you, becomes united around effective intervention. So the IEP, all right, this is your tool. This is founded in federal law. All right, they haven't repealed that yet, but this is the tool that is given to you by law, and is the tool that we as special educators need to follow. And it's really designed in a way to give equal power, even though it doesn't feel like that many times in a meeting, but equal power to all the participants. All right. It's unfortunate that many times, you go into a meeting and it feels like it's going to be a power struggle. Okay. And I think some of that's been set up by the fact that there's been so much litigation around special education. Some of it's, reinforced by, if you go back to those perceptions that people have shared about people, where we get negative images of individuals that we may be going to deal with. Not to say that sometimes those aren't true, but we many times go into meetings feel that we're going to have to fight for what we need. And I think that's unfortunate because there's a lot of wasted time and resources when we go into meetings with that attitude, or the meeting is, the person running the meeting has that attitude. It's not it shouldn't be viewed as a battle. It should really be viewed as a collaborative effort. It says here the IEP is a roadmap, and it's supposed to be a joint vision, and we're supposed to collaboratively implement it and agree upon the goals and objectives. So what does the IEP call for? It calls for, at the federal level and state level, the law calls for appropriate assessment, not just of academic skills, but also of functional skills. All right, an evaluation must include a statement of the student's current academic and functional performance levels, and statements of how the disability affects his or her ability to participate in the curriculum. Or for preschool children, how the disability affects the child's participation in appropriate activities. All right, so that's the grounding of the law. So we have to do appropriate assessments and then take these assessments to create an effective program. Go back to that puzzle, all right? And again, none of this is going to work unless the team really comes together and is effective, all right? And again, when we think about progress, we have to think about success in the curriculum, in the life of the school and the community. And the IEP is geared to look at those areas. So the IEP process becomes most effective with open dialogue and ongoing communication, ideally prior to the day of the actual meeting. If I was to say, or go back and think about over all my years in the field of education, the most successful IEPs occur when there's a lot of dialogue prior to that day. The OT reaching out to the family and talking about their priorities, the PT reaching out, the teacher, the visually impaired, this classroom teacher. When people reach out and have that open dialogue prior to the meeting, you end up with less disagreement, but you also, I guess it's not disagreement, you end up with better understanding. And people have already started building a common goal or a common vision. And it's not always going to, be agreement, but that's part of the process. Is then you discuss it. But it I often think, not to make an aside, I often think about the fact that so many IEP meetings are, a couple of days before the meeting, the parent might get a draft, and then they got to read, I don't know what we're up to now, 40 pages of stuff, all right, and try to internalize that, understand it, and then come into a meeting where all these people are going to present information about their child and then hopefully have time for questions and answers. But many times, you run out of time, or someone says, "Oh, the meeting, we have to stop the meeting," and then start it again. Um, if you really think about it, the more we can preload the IEP, meaning have open dialogue, the better it will be. For example, I know there's mixed feelings about this out in the world of special education, but getting drafts to the families, well in advance of the meeting really helps. They can read, they can look at the IEP, share questions prior to the meeting, because many times the questions that are asked are things that could have been resolved earlier. Um, and what happens is if you can do all this up front, you develop a better shared vision. Okay. You better develop an understanding of students' strengths and interests, which are the things that drive your goals and objectives. So, I, as an educator, all right, have particular um, goals that I feel your child should work on, but I may not put them in the terms that you want unless I have a good dialogue with you and a good understanding of what your objectives are. And again, it's your child, and we need to talk together about where we want to go. Um, so this comes out of in the references. I do have these books listed, but there's a great book called Getting to Yes, and it was revised and has it's still called Getting to Yes, but it has a more recent version, which is the 1991 version. And I think it has some really good advice when we're thinking about the meetings. And again, this is not just for you as parents, but for professionals as well. We got to focus on interests, not positions. Good agreements satisfy underlying interests, yet most often participants focus on stated position. We all get caught up in, and I don't like the term, but it works, silos, all right? So PT has an area of expertise, OT has an area of expertise, um, speech has an area of expertise. And, when we think about students with low incidence conditions in particular, those areas of expertise have to really mesh, all right? So for example, again, a student here at the campus school, for us to get an effective communication system in place, I need the speech and language therapist to really look at what the most effective tools are. I need to have the OT look at the positioning of those tools relative to hand use. I need to have the PT look at how we're going to attach it to the wheelchair. And again, what types of access we're going to be able to provide. I need my AT specialist there, if it's switch technology or it's Bluetooth. We need multiple people. And if we stay locked in our positions and don't open up and share our knowledge base, then the students will not benefit. All right. The interest is the interest of the student. Interests define problems. Each side's needs, desires, concerns, and fears. All right. We all have those. We have needs for your individual students. We have desires of what we want them to do over time, and we have concerns and fears. And we need to take those and really make them productive. And again, the way to do that productively is good communication. And the IEP is structured about these three topics: the interests of access, petition, and participation and support. So access, when we think about the IEP, what we want to do is we want to provide access. And that means to a wide range of activities and environments for every child by removing physical barriers or offering multiple ways to promote learning and development. Again, that gets back to teaming. All right. How can we look at the information that we need to present relative to the curriculum, with functional skills, and how will we provide access to those skills? The next area is participation. Using a range of instructional approaches, promoting engagement in play and learning activities, and a sense of belonging for every student. All right. I know we talk a lot about inclusion, and inclusion doesn't just happen in inclusive settings. Inclusion happens in specialized settings too. Anytime that we get students together, all right, to engage with one another, all right, and to engage in a sense of community, we're encouraging participation. And then supports, and this is a key area because when we think about the IEP, I know a lot of our families put more in the additional information section because of this. But when we think about the IEP, the supports are not just what are needed for the individual student, but if we're going to really be successful, we need good professional development. So, for example, for a student with visual impairments, we'll often write into the IEP that there will be orientation at the beginning of the year, maybe mid-year, in terms of training the staff on specific aspects around vision, cortical visual impairment, access to materials, how to work with students, their learning style, and put that up front so everybody walks in with at least the baseline knowledge of the student, and then that's built upon during the year. But professional development, again, is important because to think about as a support for the IEP, because many times, again, teacher assistants are new to the students. They need additional work or knowledge to be effective. And some of that doesn't always happen on a regular basis within the school year. Again, many times when school systems do professional development, it's centered around the broader school community and not so much around individuals with extensive support needs or specific support needs. Focusing on access petitioning supports will drive our accommodations and adaptations and give success in the school. So it's a long way of saying that what we're really trying to do is create a shared vision statement. What are your hopes and dreams for your child? And again, this should be asked of parents prior to the IEP meeting. And now it's even, I think the new IEP is really even more powerful because it really makes us think about the individual student. What is the vision of that individual student? And this should be developed prior to the meeting so that people have and come in with some degree of commonality of vision, because we want to create one vision for the student, that incorporates, I should have updated this, incorporates their vision, your vision and the vision of the professionals. So how does the new IEP help you build collaboration? I think that it does it through a couple of, 3 or 4 different ways. In that it's expanded looking across a fuller range of student needs and strengths in developing goals and objectives. For example, there's a broader description of eligibility. So it used to be that you'd list 1 or 2 eligibility characteristics when you're looking at why a student needs special education. And now you can list out all of those eligibility criteria. It broadens the understanding of the child and their needs, especially in the case of students with low incidence conditions. So a student here at the campus school may have communication needs, may have neurological impairments, may have vision loss, may have deafness, any number of disability groups or that create eligibility. And we want to know those because that's a more total picture of the individual student. This was on the prior IEP, but that ongoing inclusion of the autism questions, really important to be thinking about how am I integrating all the different aspects of autism learning that this student needs within the IEP. AAC, or alternative communication questions. There's a whole list of questions added, including, do they need this communication within their home setting? Really important, that we focus in on this, because so many more of our students are using assistive communication devices. Sensory conditions, again, this was on the prior IEP. It's been expanded with more questions, and it includes students with cortical visual impairment, not just students with other types of blindness or visual impairment. And then I particularly like the fact that one of the areas of focus, I mean, all the areas are important, but we do take special look at social and behavioral issues, because many times they can be not overlooked, but underrepresented in terms of the needs of the students that we serve. And then finally, one additional thing, and again, then these are just some examples, is the use of the expansion of transition planning document. Many times the transition planning document, which should have been done first at the IEP meeting usually got done at the very end of the meeting and got rushed through because we run out of time. I like the fact that it's incorporated into the heart of the document, and that starting at age 14, you really begin to start to think about inclusion in the life of the community, the world of work. Where are we going, and thinking long term, so that we are really stressing building up those essential skills, not just academic, but functional, that will enable that individual student to participate fully in society. I'm going to show parts of a quick video. I hope these don't always work for me. That will look at a successful IEP meeting or an effective IEP meeting. And the triangle indicates talking, listening, and understanding, which are at the heart of an effective meeting. So I'm going to give this a whirl. We're not going to watch the whole video. It's accessible on YouTube. There's one that also shows an ineffective meeting. That is, I can send the link if people are interested. Do I have to?
Welcome back to our reconvened IEP meeting. I think before we get started, just to make sure everyone knows each other, we should all introduce ourselves. I'm Bruce Goldstein. I'm the Director of Special Education for the school district.
I'm Sue Griebler. I'm a first grade teacher at Jones Elementary School.
I'm Joe Frisetta. I'm Reed's dad and also the designated note taker too.
I'm Gail Frisetta, Reed's mom. I'm Virginia Stern. I'm a speech language pathologist at the Kennedy School. And here I've brought a picture of Reed. I don't think any of you have met him yet.
Oh, he's
cute.
Yeah,
Very nice.
Very nice.
Thank you.
Mm-hmm. Well, we're here to pick up on the issues that we hadn't resolved at the last meeting. Talk about program and talk about services. Now, did you get an opportunity to go to the Kennedy School?
Actually, we didn't get a chance to. We had an appointment with Mrs. Stern last week, and Reed got sick, and we were unable to make that appointment. But I did have some questions about the Kennedy School, if you don't mind. I'd like to ask some of these questions. Mrs. Stern, at the Kennedy School, how many children are in each of the classrooms?
Well, altogether, we have 55 students with communication disorders, all kinds of communication disorders. And of course, they're different ages. So they spend half the day in the regular classroom and half the day in a communication-focused classroom. And there are between 5 and 8 students in those classes.
Okay. And is there individual speech therapy provided for those children?
Yes. All the children, they receive therapy 1 or 2 times a week, twice a week usually.
Just to interject, some of those are group sessions and some are individual sessions.
Mm-hmm.
Okay. And how do you work on socialization skills between the deaf and hard of hearing children and the other children in the classrooms there?
Well, since so many of the deaf and hard of hearing children have implants now, we believe that they are getting the kind of socialization language, both in listening and speaking, that is important. And so they're getting it in a natural way.
I've heard some really good things about your program. Thank you for sharing that with us.
We're very proud of our program at Kennedy. We've tried to do a school where we've really got people who have background and experience in working with deaf and hard of hearing children, so we can really provide a natural environment, but with people who have that experience. Because at the alternative at the Jones School, what's your experience? Have you had deaf
I
children?
have not had a deaf child in the class. I've had a few hard of hearing students, and some of them did quite well.
Okay. So you haven't had any deaf children in your classroom. Are you willing to work with a deaf child in your classroom?
Oh, I would be willing to. I think I would need some cues from you to make that an easier transition for him.
Okay.
We've heard you've done fantastic things with the children you've had.
Thank you.
Well, I wanted to provide some information for you also. I have a report here from Reed's Auditory Preschool. I have a copy here for you, for each of you. This report talks about the need for Reed to have speech therapy 3 times a week, at a minimum 3 to 5 times a week for 30-minute sessions. And they really feel that that's an important stepping stone for him to close his language gap. And I also have another letter here from his audiologist that supports the need for intensive speech therapy for you.
We appreciate your providing this to us. We're going to obviously have to digest this. Mrs. Stern, am I correct that typically we looked at 2 sessions a week for children?
Yes, that's what we provide. And actually at Kennedy School, because we do have the 55 children with special needs, we can arrange the therapy sessions more efficiently.
Well, we're really looking at Reed having 3 therapy.
Okay, it's a long video, but and again, it's kind of hard to dialogue over Zoom. But did that seem like it was anything like any of your IEP meetings? And you might say, well, probably not. Okay, and what you didn't see was the video that preceded this one, which was the negative meeting. And a couple of things that to note about the one you just watched is that there was an attempt to talk and to listen and to understand. And that's the key piece, all right? Now, I'm going to tell you as a special education director or interim director, and having worked with so many school systems over the years, that nobody likes surprises. Just like you as a parent, when you have a meeting, don't like it if you get a surprise that you didn't expect. The school system says, no, we're not going to do this, no way. Well, special education director is the same thing. So you saw this SPED director, when he got the report, he said, honestly, I need to look at this. We need to discuss this. If they had the report prior to the meeting, it might have gone even more efficiently, more effectively, just like if you get information prior to meetings. All right, what we want to do is we want to build golden bricks, or break down the walls, and we want to create ways that we create a shared vision and can be open in our discussions, because again, it comes down to the common interest and the common value is that we all want the best education possible for our individual students. This is the heart of collaborative advocacy. I'm just going to go through these because I know we're getting close on time. Mutual respect and trust. Regard all members of the team as colleagues and teammates. And again, none of this happens automatically. It takes time to build this trust and respect, but it needs to be our end goal. We want to develop a dialogue. Be open to diverse viewpoints. Like you saw at the end there, they said we want them to have speech 3 to 5 times a week. Well, it may be that in that environment, that may not be what's needed because everyone in the environment is trained in how to provide effective language intervention for that student. Just like if you're in a specialized school for kids with visual impairments, all the staff there are trained to provide those adaptations and learning style needs for each individual child. And then supports for the student, the staff, and the families to ensure competence and confidence in providing quality services. We want to share our vision, our hopes and aspirations, and this is an effective part of the collaboration and effective teaming. Teamwork, realization that student success is founded on interdependence. None of us can do this alone. Inspiration, acceptance of new thoughts and ideas. Out of active dialogue comes creativity and perspectives. I have to say that many of the changes that I made when I worked at Perkins and the collaborative and also here at the campus school have come out of dialogue with families where they say, can we try this? They challenge us. We have a little 5-year-old, and I'm a little nervous, who's going to start using a powered wheelchair in the building. All right. That's a big accomplishment. And, and when the parents first came, to the staff with this idea, it was like, what? He's only 5, but then they sent us a picture of him driving one of those little electric Jeeps. Developmental, remembering that things happen in incremental steps, and sometimes the therapist may have a good understanding of what the next steps are, but that together we're going to develop a process for change. The other thing about collaboration is never smooth, all right? It's always up and down, and some of that's because team members change. Some of it's because situations for your individual child have changed, and we always have to be ready to adjust and adapt. It's a combination of head, hearts, and hands, meaning that we have to collaborate together. We work with our hearts, and we implement programs effectively. I want to end with one note that, sometimes we do get caught up in potential controversy, I'll call it. And we sometimes, the step before hiring an advocate, the step before, going to mediation and hearing is to try to use the SPEDX system. And I included the link for that. And I'll stop there and we can do questions.
Yeah. Thank you, Tom. As a former special education advocate, I wholeheartedly agree with all of what you were talking about. It really does take ongoing, respectful communication and collaboration in order for you to have the most effective IEP and the best outcomes for each student. And some days it seems as though that can be easier said than done. And so the amount of work it takes to do that for some teams can be really challenging, but it's so worth it in the end. Does anybody have any questions before we wrap up? We only have a few minutes left anyway, so I'm curious if anyone has a question. Thank you, Myra. Myra's saying that you did a great presentation, so thank you for that.
Thank you. And I know can be challenging. It's having chaired so many meetings, but the more we can communicate and develop a relationship, the more effective everything is with students.
I would agree. Absolutely. All right. I think the resounding silence says you explained everything beautifully and nobody has any questions, which is great. And agreement that, collaboration is always key. Sometimes it takes a while to get there. As you said, it's an investment in time. Someone is asking if you can put in the link to the SPEDX into the chat. If you could do that, that would be great.
Okay.
Okay.
That may be a challenge.
Okay. I'm sure that between you and our Federation team, we will figure that out. So we will get that for you. And if we don't get it into the chat before the end of this session, we'll be sure to include it in with all of the other notes that we're going to be uploading to the website, so you'll have access to that, Penelope. So we'll do our best to get it done before 6, but if not, we will have it for you soon after.
Right. And if people have questions and they want to ask them, I'm available at the campus school here at Boston College, and my email is, you can put that in the chat, is millat, at bc.edu, or I could put it in the chat.
I was just typing it for you.
Okay.
So millert@bc.edu.
Yes.
Okay, there you go.
Well, thank you for this opportunity, and I hope, again, that was helpful.
Well, it's quite helpful. Thank you so much for sharing that perspective with it, and especially going into the end of the school year, where anxiety can be a bit high as we're thinking about extended school year, fall placements, and people have clearer pictures of whether or not their child may or may not have made the kind of progress they hope they made in this particular school year. So having this mindset and going into meetings with that collaboration, I always say seek to understand before you are understood, right? So really trying to get as much information as possible, as many perspectives as possible. Um, I have been in many a team meeting where sometimes the best solutions come out of, shall we say, rigorous discussion.
Mhm. Well, no,
Yeah.
I think we really have to be open to that. And
Yes.
it's hard sometimes, and you sit there and you say, oh, okay. But again, I want to reinforce that I've learned so much from the families that I've worked with over the years that, we just got to be open. So,
Oh, I just found the SpedX website, but apparently it's under systems maintenance. Of course, why not? Okay, we will get that for you.
okay.
All right, so thank you so much for joining us this evening, Thomas. We really appreciate your insights. And thank you all for joining us this evening as well. We so appreciate your coming and learning with us. Just a few things for you to be aware that are happening as soon as tomorrow. There will be the Planning the Life Conference for college and beyond. It's a 2-day transition planning conference. It starts tomorrow virtually first, and then on Saturday, it's actually in person in Worcester. So we will give you the website just a moment so that you can register. It's actually very inexpensive for parents and professionals. It's a mere $25 for the 2 days. And if you happen to be a youth or young adult accompanying a parent or caregiver, you are able to go for free. So there is the website for you to be able to go and to register for that. You can never do too much planning for a transition. So the more information you have, the earlier you have, the more options you're likely to be able to exercise in the future. So please make sure you do that. I did mention earlier, of course, the anxiety that tends to happen at this time of year. We have those of us who are advocates, we feel it coming. Suddenly, a lot of people are looking for help because they're trying to figure out what the next steps are for their child. And I want to remind you that the Federation for Children with Special Needs is always here to help you with that. And one resource that you can leverage is their information center. And so if you can do it in a couple of different ways. You can either go up on the website and actually click on their intake form. There's a blue bar there, and fill that in, and someone will call you back. Or you can call them directly at the main office at 617-236-7210. So just always remember, there's always somebody on the other end of that phone who's willing to help you at the Federation. And then the other thing to also keep in mind is the Federation is always holding some sort of information session. So there's a lot going on between now and the end of June in particular. So special education knowledge around basic rights, understanding an IEP, turning 3, and many of those are also in multiple languages: Spanish, Portuguese. I saw something in, I think it was Vietnamese. It wasn't my language, but it was very different than mine. So do take a moment to look on the calendar in the Federation's website and see what kind of information is in there that could be useful to you. As someone who has been an advocate in the past, I can tell you that my best clients were ones who were educated and informed. And so now there's no time like the present to learn more about the special education law, how to navigate the system, and how to partner with your advocate and your special education team on getting the best possible outcomes for your student. So thank you again for joining us. Thank you again, Thomas, for joining us this evening. Have a wonderful evening. Be safe out there. Enjoy this weather. We wish you all the best, and we will see you again next month. I believe it's on the 5th of June, which is our first Thursday, for our next Connecting Families. In the meantime, have a great evening and stay safe.